Madam Secretary. We just heard from Mr. Becerra, who criticized critics on and characterizing it as misinformation or disinformation and scare tactics. And yet that wasn't what we heard from Mr. Doggett. Mr. Doggett was essentially admonishing the department for a lack of information and a lack of accountability. So I want to associate myself with the spirit of Mr. Doggett and also bring in one of the themes that Dr. Price was trying to articulate, and that's this. Wouldn't it be great, Madam Secretary, if Dr. Price, in the question that he asked, you were able to say, here's the answer. Here is the answer. When he made the inquiry and you said, you know what, I don't have that information. I'm just the Secretary of Health and Human Services. That is with the private insurance company. That was your answer a minute ago. Wouldn't it be a great thing if you were to say, here's the information and here's the answer? And the problem is, at least as far as the construction of the Affordable Care Act as it's currently constructed, some of this information you may not know, some of it you may, but it's because of limitations of the Act itself. So we've got an Inspector General, and your own Inspector General is only able, Madam Secretary, to go and ask inquiries of Health and Human Services. That Inspector General, who reports to you, cannot go and make any inquiries to Treasury. One of your earlier answers, you cited tax credits. Well, when it comes down to it, the HHS Secretary has no jurisdiction over tax credits. You don't know what's happening in that other department. Wouldn't it be a good thing if we were to amend the law and you had that information and there were a special Inspector General that had broad jurisdiction? Wouldn't that be a good thing?
I don't think that's necessary, and I think that's additional expenditure. I will give you the information as soon as we have it, and we will have it from insurance
but by your own admission,
but
you
we
don't
do not have it now.
So why is it a good idea to have a special Inspector General for Iraq reconstruction? Why is it a good idea to have a special Inspector General for Afghanistan reconstruction? Why is it a good idea to have a special Inspector General for TARP oversight? Cumulatively, all of these have literally saved billions of dollars. The Affordable Care Act, according to the Congressional Budget Office, is a $1.8 trillion expenditure. What is it that is sacrosanct that says that this should not be subject to that broad jurisdiction? By your own admission, you don't know the answers to these questions, do you?
I could not answer Dr. Price's question because I don't have the information from the insurance companies yet.
Right, because
we will
you
have
can't
it, and I
reach
will.
Out.
This is in the private sector. This is not Treasury. This is private insurance companies.
That even begs the
300
question.
of whom are
You
selling
can't get to
policies
it.
in the marketplace.
Your Inspector General can't get to it.
This is not an Inspector General issue. It's private insurers who are selling plans to their customers. They can tell you how many of their customers have paid their bills.
And you don't have the information, and you don't have the capacity to information.
I would just say, Madam Secretary, part of the frustration is that you did have the answer to the number of insured children, and that is also private sector information, but yet when we're trying to get further information, we don't.
That came directly, Mr. Chairman, from the insurers. And I'm telling you, as soon as we have this information from the insurer, we don't collect it. We didn't have it. They turned that in to us.
All right. Dr. Bustani.